Hello, my name is Brittany Bennett, and I will be going over the AP scapula. Patient preparation is to confirm the patient's identity in 3 ways. Wristband or paperwork, ask the patient to state their name and date of birth. If female, confirm the last menstrual cycle date. Confirm with the patient what we are imaging to confirm the order is correct before imaging the patient. Make sure to shield the patient with the appropriate lead shield. Make sure to remove all jewelry, metal is taken off in the area of interest. Also ask the patient to remove any undergarments in the area of interest. The IR size is 10 by 12. The IR orientation is portrait. The IR location is the wall buggy. The SID is 40 inches, which is 100 centimeters. The patient position is erect and the patient's body is up against the IR with no rotation of the body. Patient is facing away from the IR. Part position, you will make sure that the mid-scapular area is centered to the CR. Abduct the patient's arm 90 degrees as if the patient is saluting the machine. The patient's hand is supinated. The CR location is perpendicular to the mid-scapular area, 2 inches inferior to the coracoid process, and 2 inches medial from the lateral border of the scapula. The CR angulation, there is none. The collimated field size is 1 to 2 inches above the skin of the shoulder, and palpate the inferior angle of the scapula to make sure it is within the light field. The kVp range for the real patient is 70 kVp. The instructions to the patient for exposure, you will ask the patient to hold still but to breathe normally. Anatomy demonstrated, the lateral border of the scapula should be free from superimposition of the ribs. You can see the medial border through the thorax. Ribs and lungs are blurred due to normal breathing. The items in profile is the humeral head is in partial profile. Pathology best demonstrated clinical indications would be fractures of the scapula, dislocations, and other pathology of the scapula that could be present. You will also be able to see the clavicle, the coracoid process, the glenoid cavity, scapula, the lateral border of the scapula, medial border of the scapula, inferior angle of the scapula, the 5th rib, 6th rib, the humeral head, jugular notch, AC joint, SC joint, 1st rib, and the transverse process. And that is the end of the slides. Thank you so much, and I hope y'all have a great day.